we started the study because the concern in SCD has always been strokes, but this is at older ages, and so we wondered, when do the effects of SCD first manifest to cerebral health? And so NIRS technology, especially with diffuse correlation spectroscopy, gave us an opportunity to look at this at the earliest stages when it's hard to get MRI or even transcranial Doppler.
So just add on to what Jason mentioned. So our background is we are both engineers, and our group at Fetal Neonatal Neuroimaging Science Center, we specialize in developing non-invasive tools we can use to monitor babies' brain hemodynamics. And in the context of their brain injury or disease progression, or even with their recovery from the treatment. So we originally developed this tool for infants in the intensive neonatal unit care with some babies born prematurely with brain injury or born with some certain episode of birth asphyxia. And we found, our tools are, first of all, it's very feasible in terms of the setting of intensive care unit. And also from our previous research, we found the monitor of their hemodynamics, especially in the context of blood flow and oxygen metabolism, can predict their later outcome after they discharge from the hospital. So we specialize in this technology and would like to extend the application to other disease in terms of more like relate to their cerebral hemodynamics. So we started the other study, like Jason mentioned, the sickle cell patients, because most of the research are focusing on the incidence of stroke, which will happen much later after probably 3 years old. So, but there's really lack of any type of cerebral monitors to monitor their hemodynamic stress, which could potentially be an early marker of the stroke. Yeah, and this is our first presentation in terms of our preliminary data study in terms of using this technology in monitor their hemodynamic stress.
I guess I'll maybe build on that and say, it's not that often that we can do things better in infants than you can in adults, but with optical devices such as the ones we use, the frequency domain near-infrared spectroscopy combined with diffuse correlation spectroscopy, we can get quantitative data because the skull and scalp is thin in infants. So we actually get more accurate measures of cerebral oxygen metabolism, which includes a measure of cerebral blood flow, than you can in adults. So we have a tool that gives us an opportunity, and then thinking about brain development, because there's such stress on oxygen and substrate supply in infants as their brain are growing rapidly. So we're wondering, is there a global impact of SCD more in limiting the potential for cerebral growth and development because of limited or impaired oxygen delivery? So not looking at the focal infarcts, but more the global oxygen delivery that might be having an impact early on in the stages of sickle cell disease. And talking to our hematologist, we found that there was a bit of a debate about when to start treatment. So we got really curious as to see, well, when do we start to see problems with oxygen delivery, as we would suspect with increased, say, blood flow to make up for the decreased oxygen carrying capacity? When do we just start to see that manifest? So that's why we started to look, is to see if we can help with measures with our optical devices to figure out when they are starting to show the first signs, which might just be limited development of oxygen metabolism, which tracks with cerebral growth.
Children have twice the metabolism, cerebral metabolism, as adults, because their brain is not just functioning, it's also growing. So that was the impetus for starting the study, was to look to see if there are other potential pathology besides risk of stroke. So we started from this very young cohort to look to see, when the pathology was evident. And we saw, even at the youngest ages, that oxygen extraction, blood flow, blood volume, and brain hemoglobin content were all impaired, starting from the earliest ages. They just had worse cerebral hemodynamics than their peers. And the normal, because we were able to follow them longitudinally, the normal growth patterns that we see of the increase in CBF were absent or attenuated. And we saw evidence for increased flow and extraction compensating for lower oxygen delivery. So we conclude that the FD-NIRS DCS technique clearly detects hemodynamic stress starting from the earliest ages. When we measure them, their oxygen blood flow and oxygenation, they're just different than their peers, their unaffected peers.
Yeah, just one other point I just want to make sure is clear is like there is an increasing risk of stroke, which is a focal event. But what we're seeing here is there may be a global impairment of oxygen consumption that may have a global effect on cortical development and brain growth. So there's kind of two different things that we're looking at, and there may be more of a global impairment that has downstream consequences in addition to those focal strokes. So that's what we're really interested in here. And also we'll want to follow these kids' brain growths and see if we see, and ideally get a matched cohort that we can look at both of them and see if these hemodynamic changes do track with slower brain growth, because then that would be motivation again to get in earlier with some of these treatments and to test whether getting the kids on hydroxyurea early actually improves that growth curve.